Leigh Caswell, welcome to the podcast, More Health, Less Healthcare. And you're Vice President of Community and Health Equity at Presbyterian Health in New Mexico. First, just right off the bat, I have to express a lot of appreciation to this remarkable case study, which you contributed to the Health Equity Case Studies Handbook. It's one of the clearest, most impactful statements of um, an organization's values. And what really comes through clearly, Lee, is that the organization really took seriously, the adage about the community voice, that at least what I learned in the process is that what the community's priorities were became your priorities. And I think that's a rarity, literally, that's a rarity in that when you look at what your methodology was, what the values were, what the methodology was, what the impacts were, and all the steps that you took to get there, it's a very clear through line of these are community priorities and what your accountability is. Your accountability is not just to your board, it's to the community. And I think it's just a wonderful case study that I've learned a lot by it. I think all our viewers will too. So I'm curious, how did you get involved in this part of the business? And what role does equity play, not just in your work and your team's work, but how then do you connect this to the various parts of this large organization, Presbyterian Health?
Great. Thank
Tell
you.
us
Thank
about
you,
it.
Peter. Yeah. First of all, thank you for saying that. It's incredibly validating to hear other people see this work as meaningful because we're often so busy just doing the work. So thank you. I really appreciate your broad perspective. So in my career, I have always either been at local government or at an academic health center, always in the role of how does the institution respond to community priorities? How do we leverage our resources to do that? And so I've learned a lot in that process. And when I was hired at Presbyterian almost 13 years ago, to lead our community health assessment and implementation planning process, I took a lot of what I had learned about what it means to be an anchor institution in the community and and what it means to be a true partner. And as a public health leader and advocate, I'm not looking just at individual behavior change, but really how are we changing our communities so that everyone can thrive. And so I brought this idea of public health and population health and equity into our work and really having meaningful partnerships and community as we do that work. So in these years, as we've done our cycles of assessments and plans, we've really grounded equity. And we heard this from our community that we should not be working on improving health for just anyone, but really looking at who is struggling the most and how do we help them to achieve their best health.
Well stated. So you describe your team's work in community health as a type of incubator. Okay, what is an incubator? What's the why of an incubator, and how does it work?
Yeah, great question. So, foundationally, we're going into the community and they're telling us like these are the things that are not working for us, right? And if we had already been doing that work as a healthcare system, it likely would have been funded, right? And so
Mhm.
we're we're innovating, we're hearing what are the gaps in the community. And I'll give you one great example, our peer support specialist program. So behavioral health has been a number one priority of our communities since the beginning. And we were able to find some seed funding to start a peer support specialist program. And these are people who are in recovery from substance abuse, and they're located within our emergency departments and our neonatal intensive care unit. So when people come into our healthcare system with a drug or alcohol, substance use issue, these people who have lived experience are there supporting them along the way and helping them to access recovery services. So that's one example where we took some external funding, we built this model that was solving the one. helping to solve this intractable problem in our communities, right? And then over time, we're able to build it to a point where there are now billing codes, so we can begin billing our state for these services and really scale it up so more people have access to this important resource.
Well, I'm pleased you mentioned behavioral health, mental health. It's kind of been the stepchild of the healthcare industry for a long, long time. Why is it so important? Why is it so foundational to your program? What's the lived experience? I mean, anybody who's worked in an ER understands what the impact is. How did you come to focus on this as a major, major cornerstone?
Yeah, well, it was our community data that told us that we have high overdose death rates, we have high alcohol use in our communities. It's really impacting most families in our state and probably across the nation. So we really looked at what are the gaps? Like what gaps can we be filling? And like you said, in our emergency rooms we have a lot of folks coming in with these struggles, and not only are they not getting what they need when they come in, but our providers are feeling the stress of serving patients who they don't have the resources to support. And so these programs, like our community health workers who are helping with social needs and our peer support specialists who are helping people access recovery, not only create a much more meaningful experience for our patients and connect them to the actual resources they need, but they also can help our providers with this moral injury that comes about when they're left trying to treat folks but they don't have the tools that they need, right? So um, it's it's been meaningful in a lot of ways, and and it's another example of where our strong relationships in the community really make a difference. So, we're staying in touch with the different behavioral health providers in the community while also, this is another good example of one where we're looking at the spectrum of interventions, right? We're not just saying, oh, people need to make different choices, right? We know that is
Yeah.
hard and it's not that simple. So we're increasing access to Narcan in communities to make sure that that's available when people are experiencing overdose. We're doing campaigns around anti-stigma. So people in communities who are struggling with behavioral health issues are treated with more respect. We're doing education around mental health first aid, so our entire community knows how to support each other when there's a mental health or substance use issue in someone they care about.
Well, I'm glad you use the term moral injury. This is a very, very important learning that I hope the industry as a whole understands this. That's very, very important. So when you talk about trying to deliver community health and how you track your progress, and it begs the question, what do you mean by community health? But when I looked at what your geography was in the various counties, and you went county by county in the case study, and you really went into a lot of detail of what the various needs are in each county. So what do you mean by community? Who is your community? And then how do you track the impact of the intervention year by year?
Yeah, great question. So we say in our purpose as an organization that our community is patients, members of our health plan, and our broader community. And our organization serves nearly half of this state's population. So our community really could be anyone, and
Mhm.
people, are coming and going from our health plan and our delivery system at any time. So we really see our community as this entire state. So we've focused on the entire state. And your next question about how we track progress and what is community health. So again, we're looking at a public health or population health model. So we're really thinking through not only how do we support people to make different choices individually, but how do we support families and communities and institutions and um, in our environment? How are all of those levels of intervention being supported to help achieve health in our communities? So that could be um, are are we looking at intersections where there's a lot of pedestrian fatalities, and are we working with our transportation planners about how to create safer intersections? Are we investing in the food system? We've done a lot of investment in our local food system because we know not only does that create jobs in strong economy, but it also allows us to have more access to healthy food for our patients and our members in our communities. Um, so we're thinking really broadly about community health. And it's definitely not the traditional, this is what you receive when you go to a doctor's appointment, right? We know that 80% of what contributes to health outcomes for folks is something that's outside of the hospital walls. So we've really focused on impacting those things. And so as we're looking at how do we track outcomes, we're aligning with our state. What are their goals? And from those goals, we're then looking at what are our organizational goals and how are our programs contributing to reaching those goals. So for all of our priority areas, we are tracking outcomes all along the way to see if there are changes for our communities.
Well, I mean, you hinted at the word intersectionality. You have an organization that's the hospital, but you also have an organization that's the health plan, right? And then we have foundation, a lot of other parts. Then you have the community. When you look at what the state has in mind, if you look at the state's priorities and you look at the organization's priorities, do you run into a difference between what the hospital portion and the health plan portion, what their goals and responsibilities are, or do they somehow symbiotically work together?
No, they work together. I mean, it almost without fail, the things that our state is telling us our priorities are also things that we're seeing in our community, and they're also issues that are impacting how we provide care. So we're not seeing conflict, we're seeing synergy in those areas, and it's helped us to have a lot of meaningful partnerships, again, with the state, with our health plan, in how we implement our work. And I think that's a sign that we're doing something right, that we're listening, that we're partnering, in a meaningful way.
Well, it also has maybe a sign that you're doing something right.
Yeah,
Oh,
absolutely.
okay. As a recovering consultant, and I look at the breadth of your activity and the size of your outreach, it says this is going to take a lot of capital. So I'm wondering, as you size what it is that you want to make sustainable, what are we talking about? If another organization says, well, these guys have cracked the code, what can we learn from them? What are table stakes for an organization that wants, even an organization that's all in? Is it $1 million? Is it $5 million? How do you figure out what the budget can be to scale to where you want it to be sustainable each year?
Yeah, that's a great question. I
And
mean,
the
I
second
think it,
one, where does the money come from?
yeah, yeah, yeah. I think it's good that I come from a background where I didn't have any budget because I think we have to think about this work as partnership, and we have to think about leveraging infrastructure. So it's not all about budget, and I'll answer your question in a minute, but it's about what resources do we have as an institution, whether that's our workforce, our facilities, our purchasing power, our legal infrastructure, our contracting infrastructure. We're really, one, foundationally leveraging all of that to support the work. And I think it will really depend on the size of an organization, but about half of our dollars, about 2.5 million is a community benefit contribution from the organization. And then we also have a contract with our health plan that funds the work as well. And then the other half, we've been able to leverage federal dollars, like from the Centers for Disease Control, USDA, foundation dollars, private foundation dollars, dollars from donors, and contracts with our state. So, um, because we have so intentionally aligned with our state priorities, which are a part of Healthy People 2030 priorities, there is a lot of alignment with these different funding sources. And since we've proven to be good at operationalizing these really challenging programs, we have these great relationships with our funders, and they want to keep coming back to us to do this work because we've been, again, successful at implementing it.
One of the things I clearly remember from one of our conversations is that if you get a contract from a federal government, wherever it may be, every dollar that comes in, there is a price attached to it. The regulatory and oversight functions, let's say it's $1 million, $100,000, whatever it may be. How much of that money do you really spend on the patient and advocacy as opposed to regulatory compliance, which is just part of the package?
Yeah, yeah. So, yeah, we talked about, academic institutions and how if they have a federal grant, nearly half of it is going to
Mhm.
the indirect rate,
Right,
right? And
right.
that's part of our community benefit is that our organization is saying we're good at managing federal dollars. We're going to leverage this infrastructure and not take that out of the grant dollars for the most part, right? And so that means we're able to put more money towards the programming, put more money back out into the community. And this is something we've heard from others is that having organizations like ours who are good at managing federal dollars because it comes with a lot of strings attached,
Right,
right?
right.
That having organizations like us who can bring partners together and then subaward or contract back out into the community to our smaller nonprofits who don't have the infrastructure to manage large federal grants, that is also sort of a community benefit that we
Right.
provide.
Yep.
And so really grateful to have an organization behind our work that allows us to do that.
Well, that leads me to an obvious question that as you look back, as you've gone through this pipeline of challenges, you look at back, let's say 3 or 4 years, are there two or three challenges that were big challenges? And how did you address each of those? And were some of those surprising?
Yeah, big challenges. You know, we are kind of like a startup within a healthcare system, right? We've gone from 1 to 70 people in this 10 years. And I think having the mindset where you're constantly questioning, like, is this the right infrastructure? Is this the right work?
Mhm.
Um, are we aligned with our community? How do we need to evolve? All of those questions have been really important for us. And um, how do you take these programs like a food prescription or a community health worker or someone who's in recovery working within a healthcare system? How do you take those programs and integrate them within a system that is just not used to that type of work,
Mhm.
right?
Mhm. Right.
That looks at a prescription and 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 doesn't think about that as food, right? So we have to do a lot of education. We've had to do have a lot of conversations about how can we make this work instead of like what are the reasons not to. Um, so like integrating this work into our electronic medical record so you can
Mhm.
refer to a food pharmacy through that EMR. Um, those have been a lot of the challenges. Not having this work be seen as an aside, but really having it be seen as a part of how we provide care now for our patients.
All right, so look ahead a few years. You're committed to making whatever the initiative, be it sustainable. Where do you see the incubator going? Let's say the next 3 or 4 years. What do you want to take on next?
Yeah, we just completed our next community health assessment and planning
Okay.
process, and that's just such a meaningful process where we engage with a lot of community across the state.
Hold on. Could you
Um,
tell what does that engagement really consist of? This is really an impressive
yeah,
building block.
you know, for one, we hear from our communities, stop assessing us, right? There's a lot of assessment happening and not a lot of action. So we've
Mm.
intentionally partnered with others who do assessments to make sure we're working together, not duplicating work, not putting undue strain on our communities. But we meet with folks across the state at a lot of different levels to really hear, does this data reflect what you're experiencing in your communities? What are your priorities? What are the assets we should be building on? What are the gaps we should be looking at and helping to fill? So we go through this whole process. And again, what's important to me is that these aren't new relationships for the most part.
Right.
It's important to me that we are in community and we show up regularly without having an ask. And I think that helps that when we do come around to do this process, that we have strong, trusting relationships and that our partners know that we're going to take action based upon what we hear. So that's a big part of the process. And then again, we build plans based upon what we learn as priorities.
Okay, so going forward,
So
where,
going forward,
where do you want to be in 3 or 4 years? What will the incubator have manifested
what will we have
with a
manifest?
lot of hard work?
Yeah, right. Well, I think our challenge now is scaling and sustaining these programs. So they've grown a lot. And now it's how do we leverage our funding models? How do we leverage value-based care? How do we leverage new billing codes for social care and billing codes for our peer support specialists? How do we then scale up this work in a meaningful way and measure impact? We're doing a lot of work in food as medicine, and that's something we've been doing for 10 years or more. And now it's getting a lot of attention and hopefully some more funding from the federal government. But how are we showing real health outcome changes for our patients so we can continue to build the evidence that these programs are meaningful? So that's a big theme, is being more um, thoughtful about how we measure impact. And but I don't see the work changing significantly. I just see it growing. I mean, these are consistent challenges in our communities that we're addressing, our social needs, our, behavioral health issues, and our communities continue to say, how are you going to do things differently in your healthcare system? How are you going to continue to change the healthcare system um, to provide care in a way that is really meaningful to us? So I don't see big changes. There's, of course, programs I want to do. Medical legal partnership, has been a dream of mine for a long time, but I think we're on the right track. Continuing to do more work in our priority areas for health equity work. So our perinatal population, how do we get better at providing prenatal care and postpartum care and addressing postpartum depression across our state and our many diverse communities? How do we provide better care for our Native American and Indigenous communities? How do we look at traditional healing policies and really strengthen our relationships in our tribal communities is another area. Um, so yeah, all of that. We have a lot to do. And so I think we also need to figure out how to stop and celebrate the progress that we've made. And so I want to appreciate you for the work that you're doing and helping to elevate good work that's happening across the country, because I think we all need to stop and celebrate the progress that's being made.
That's for sure. This is a good way to wrap up with maybe a last question about what's your optimism that your health equity blueprint is going to work for not just the organization, but for the community as well. Two different partners. How
Mhm.
do you fulfill that goal of both partners, and why are you optimistic going forward?
Why am I optimistic? Um, you know, this last year, there's been a lot of questions about our federal funding, and
Yeah.
I'm optimistic because it hasn't gone away yet, and the work continues to grow. And if anything, there's just more and more interest and validation within the organization that this is the right work. That equity continues to be centered as one of our must-dos of compassionate, safe, equitable care. Um, that our communities are reinforcing for us that these are the right priorities that we're working on. And again, our partnerships in the community continue to grow. And the culture of this team within Presbyterian that is doing this work is so strong. And so I get to spend every day with people who are like doing heart work. And that makes me really optimistic for the future that there are a lot of people out there doing that work. So yeah, there's a lot of things that make me optimistic.
All right, you made me optimistic, or filled my optimistic quotient for the day. But Leigh, thank you so much. We have learned a lot working with you, and I hope that people around the country, as they read this book, will understand that you can do heart-based work, and it can be within a budget, and you can deliver and improve people's lives, and within a 10-year span. So I'm optimistic about your optimism. So
Thanks,
Leigh,
Peter.
thank you very much. It's been a pleasure.
Yeah, thank you.
Yeah.